In January, I had to come in for it was supposed to be my 3-month checkup, but I successfully managed to move my 3-month checkup to a year checkup. The chart of A1C, it goes from 7 being diabetic to 10, and then you have your numbers that are lower. I didn't think that my results would be bad, but when I got the results back in January, I was at 10.2.
My patient Sharon came to me, Dr. Hembry referred her to me. Her blood sugars were really high, so that was a concern.
I was spiraling towards 300 pounds. When you get between 250 to 300, that's a really bad place to be. It was a harsh reality of a wake-up call of being diabetic, and I felt like I was on a razor's edge, and I was either going to go one way or the other. But I kept thinking I could take care of it myself and I could do everything myself. I didn't think at that point that I really needed help, so I really had a very negative attitude.
At first, she was not real receptive to receiving the help. As we sat there, she realized I wasn't going to tell her what to do, but we worked together and talked about what she wanted to do. That made a difference. When she came back, she had a whole different changed mind, was really surprised me.
I started to realize that she could tell me things that I didn't know. I had no idea, like you should eat a protein and a carb together, that when you're diabetic, calories don't matter, counting sugars don't matter. Really, the thing that you really want to watch are your carbs. And she began showing me things that I had never known.
She just turned things around. She started running and changing the way she ate.
So I began to learn that there are easy ways for me to just start changing my life.
Dawn does a lot of counseling, and that's where that can be really helpful, because once you address some of those underlying issues, all of a sudden the medicines are working now. Their hemoglobin A1C is at goal, the patient's happier.
Patient-centered care means taking care of all the patient's needs. That is emotional, physical, social, kind of wraps up into my position and the doctor's. So it means touching base with all the team members.
Dawn and I will meet frequently to discuss Sharon's goals, discuss how she's doing with her exercise, her diet, her weight. We can interact several different ways. Dawn sends me regular updates on the electronic health record, telling me, your patient's doing great, her blood sugar's under good control, this is our plan. But also she'll catch me if there's a problem or concern.
The teamwork that we have here is incredible, and kind of like a family setting. We all communicate pretty well, and it's all part of that medical home.
Dr. Hembry referring me to Dawn changed me. It changed my life. It changed my outlook. As of today, I've lost 47 pounds since January. I'm training for a half marathon. I'm on week 10. But having Dawn here, I can't thank UnityPoint enough for having her, because if they didn't have her, I wouldn't be sitting here today as a success story. I literally, it makes me want to cry, because I would be sitting here as a negative statistic of somebody who possibly could have kidney failure or go blind from being diabetic or just spiraling out of control. She's changed my life.